Hello everybody, my name is Adelaison Bwaga. Today we will be learning about the disease that is so popular in Africa, and exactly in this farm also we have the disease called pink eye disease. This is a disease that faces cattle, and actually today we'll have different doctors and animal scientists, people who have profession. They will tell us more about the disease, so we'll know more about this disease. Welcome to my class.
Hello, my name is Dr. Winfred Ngilangwa, and I'll be speaking to you about the clinical signs of a disease called infectious bovine keratoconjunctivitis, or pink eye disease. Okay, so this disease of infectious bovine keratoconjunctivitis or pink eye disease has a number of clinical signs in animals. The first clinical sign that happens in animals is inflammation of the conjunctiva, and this inflammation of the conjunctiva leads to redness of the eye. So you can see the animal with red eyes, then you can easily know that this animal is affected with pink eye disease. But also another clinical sign of this disease is discharges from the eyes. So animals which manifest this disease always have discharges in their eyes. But also this disease, when remain untreated, it can lead to blindness in the animal. As you can see from our farm here, many animals are affected with this disease of infectious bovine keratoconjunctivitis or pink eye disease, and they are blind. So if it remains untreated, it can lead to blindness. So that is the final or concluding sign of this disease.
Okay, ladies and gentlemen, we have heard about the introduction of the disease, but also we've heard the clinical signs of the disease. But how did this disease get treated? Let's hear from the animal scientist.
Hi everybody, my name is Absalom Komanya, an animal scientist, and today I would like to share with you some methods that are used to treat a disease called the pink eye disease. Why we need to treat this kind of disease? Because most of the livestock keepers in their farms, they face challenges to this kind of disease, and they don't know how to control. So in my experience, I've seen most two ways to treat this kind of disease. First of all is by using antibiotics, but also by using anti-inflammatory drugs, because this kind of disease comes with clinical signs like infections of the eye, especially on the conjunctiva, but also the inflammation of the eye, especially on the same part, the conjunctive. So when we use the combination of these drugs, the antibiotics, but also the anti-inflammatory drugs, we help the animal to treat that kind of problem. But when we treat, we need to know the contraindication of the drugs, especially the antibiotics, but also these anti-inflammatory drugs, because they have an effect to the pregnant animals. When we use these, it can lead to abortion. So before we administer the drug to this kind of animals, we need first of all to do what we call pregnancy diagnosis, in order to know if the animal is pregnant or not. Because if we do without doing so, it can lead to complication, especially during parturition.
Hello, I'm back again, and now we are going to learn practical, and we see things practically, and we are going to the place where they already confined the animal, and there we are going to learn. This place is called a crash area. There they are going to treat the animal. They are going to show us several steps. Welcome, and let's go guys, let's go.
So now we are here to the clash to see how the animal is treated. But before we treat, we need to follow the contraindication of the drugs. As I said there, we need to confirm if an animal is pregnant for the case of a cow. But if it is a bull, there's no need to confirm if an animal is pregnant. So the first step, this is a cow, as you see. So we are going to test for pregnancy. And if the animal is not pregnant, then we will see how we treat. Now we are doing a diagnosis for pregnancy to this animal. As you see that there, the first step is lubrication, as you see there, before inserting the hands to the rectum of an animal. So the hand is going to be inserted to confirm or to diagnose for pregnancy there. So you do lubrication so that to prevent abrasion when inserting the hand to an animal's rectum. So our animal have been diagnosed, and the result is that she is not pregnant. So we are able to conduct a treatment as we said. So let us see how the drugs are administered. It is injecting the cow with the drug into the conjunctiva there.
Yo, I'm back again. We have heard about how the disease can be treated, but let's hear on how can we prevent it, because prevention sometimes is better than treatment. Let's hear how can we prevent it. Welcome.
My name is Sekela Makihaba, and today I would like to present to you about the preventive measures of this disease known as pink eye disease. This disease is controlled simply by the controlling of vectors known as first flies, like you can see the one which are flying all around here. These vectors are controlled by spraying of cattle or animals, and second, the proper hygiene of the animal premises, like where I am this time. To insist, the effective spraying of cattle is done with the use of insecticide to make sure the disease vectors are no longer surrounding the cattle, drop on their faces, and if they do, they are killed and then disappear from the cattle environments. And second, the clearance of the animal premises as well is done with the use of insecticide so that the disease vectors are killed and at last disappear from the animal premises for the safety of the cattle.
Hello, I hope you have learned a lot, and I would like to thank the team I've worked with. I would like to thank Mr. Ngilangwa, Dr. Ngilangwa, Mr. Komanya, and Ms. Sekela for the explanation and everything that they've done, but also thank you for the team from Matiole students who have helped us a lot. We all say thank you and bye-bye.
Bye.
Whoa. I hope everybody have learned a lot. We've seen the treatment, we've seen people talking about this disease, we've seen about those flies, we've seen the blind cattle, and I think we have learned a lot. So if you have any question, any comment, you can drop your comment down there on the video. Thank you.